Before we start our somatic movement practice, we're going to do something simple but really powerful. We're going to take a quick inventory of your body exactly as it is right now. There's no right or wrong way to do this. You're not performing, you're not fixing your posture, you're just listening in. Let's begin by standing. Just find a normal, easy stance, nothing to fix, nothing to adjust. Let your arms hang loose at your sides, and when you're ready, close your eyes. Or if it's more comfortable, you can simply soften your gaze and look down at the floor instead. For the next minute or so, we're simply going to notice. Not change anything, just notice. Here's why this matters. Most of us walk around completely disconnected from what our body is actually doing, where we're holding tension, where we're off balance, where something's been quietly working overtime without us ever noticing. This first check-in gives you a true before picture. Then, once we've finished today's practice, we'll come back to this exact same position and we'll get to feel the after for yourself. Often that's the moment it really clicks, where you can feel the shift in your body rather than just hearing about it. Start with your feet. Feel how they're meeting the floor. Is more of your weight sitting back on your heels or forward on the balls of your feet? And side to side, do you feel more weight on the outer edges or the inner edges of your feet? Now check right versus left. Does one foot feel like it's carrying more of you than the other? Does one just feel different somehow? Bring your attention to your knees. Are they locked and pushed back, or are they soft, maybe even a little bent? And your hips, does one feel higher or sit differently than the other? Notice your pelvis as a whole shape. Is it stacked evenly over your feet? Or does it feel tipped forward, belly forward, low back curving in? Or maybe the opposite, tucked under, belly held tight? Bring your awareness into your low back. Any tightness there? Any tension? Move up through your upper back, your chest, your shoulders. Same question. Any areas that feel gripped or held? Are your shoulders level or is one riding higher? Are they pulled back and your chest lifted or rounded forward? And is one shoulder further forward than the other? And finally your neck and head. Any tension through the neck? Is your head sitting straight or leaning forward, back, or off to one side? Then whenever you're ready, let your eyelids flutter open. Stay standing right where you are for just a moment. You don't need to hold on to anything that you've noticed, just let it settle. Because once we've moved through today's practice together, we're going to come right back to this same standing position, and you'll get to feel for yourself what's changed. Now come down onto the floor lying on your back. Bend your knees, feet flat, then set them hip width apart, close enough to your body that holding this position takes almost no effort. We'll call this neutral. If you're comfortable closing your eyes, let your eyelids softly close. And take a moment to notice your breath as it already is. Is it moving into your chest, down into your belly, a mix of the two? Rest your palms on your lower belly. This gives you something to feel as you breathe, and bringing touch to an area like this can increase your awareness of it. Now start to take slower, deeper breaths, aiming that breath down low so your belly rises to meet your palms. Picture your belly like a balloon filling from the inside. Inhale and let it rise and expand under your hands. Then let the air empty out slowly on the exhale. Keep breathing in this way. Bring your hands down to rest on the floor next to your hips. Now let's find your sacrum. This is the flat triangular bone at the very base of your spine, right where the curve of your low back ends and your tailbone begins, nestled between the two back points of your hip bones. Right now, it's the part of your low back that's already resting on the floor. So go ahead and gently press your sacrum down into the floor, then slowly release. Do that once or twice more, just so you get a clear sense of exactly where this is. As you press your sacrum down, you might notice the back of your head presses into the floor as well, and that's completely normal. Just let that happen naturally and don't try to stop it. Now we're going to learn a movement called the arch and flatten. We'll start with just the arching part on its own, then we'll work on the flattening on its own, and once we've got both, we'll put them together. So when you're ready, breathe into your belly and gently press your sacrum down into the floor. Keep that pressure steady as you slowly begin shifting it towards your tailbone. Your belly will push even further out and you'll feel your low back start to lift and arch off the floor, with your low back muscles gently engaged. Then as slowly as you possibly can, exhale and let that contraction go as your pelvis rolls back to neutral and your lower back floats back down to the floor. Don't use your belly to pull yourself back. Just let those low back muscles lengthen and release on their own, all the way back to neutral, right where you started, breathing as you need to while you release. Then pause in neutral, making sure that you have released completely. We'll do that movement again. Breathe into your belly and gently press your sacrum down into the floor. Keep that pressure steady as you slowly begin shifting it towards your tailbone. Feel your belly push further out and your lower back lift and arch, lower back muscles gently engaged. This time, we'll count to 12 as we slowly release back to neutral. Don't hold on to your breath, just breathe as you need as you lower your back to the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Take a moment in neutral, sensing how you feel from the inside and making sure that you have released completely. We'll repeat the arch one more time. Breathe into your belly and gently push your sacrum down into the floor. Move the pressure toward your tailbone. Feel your belly push further out and your lower back lift and arch. Then we'll release to a slow count of 12. No force, just slowly letting go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Rest here. Now let's add the flatten. Resting here in neutral, inhale into your belly, but this time don't arch. As you exhale, gently press your low back down into the floor. You'll feel your abdominal muscles switch on to help create that press. Then when you're ready, release those abdominals as slowly as you can. Bring your pelvis and lower back to neutral. Let's flatten again. Breathe in, filling your belly, and as you exhale, press your lower back down into the floor. This time, see if you can hollow your belly in as you do so. Imagine drawing your belly button down toward the floor. Notice how this calls on abdominals in a slightly different way. Then release as slowly and as smoothly as you can back to neutral. One last time. Inhale, expanding your belly. Exhale and press your lower back down into the floor, hollowing your belly and engaging your abdominals. Notice your pelvis moving the opposite way from the arch. Your tailbone might lift slightly. Now let's release to a slow count of 12. No force, just slowly letting go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Take a breath. Now let's link them together, starting with the arch. Inhale, filling your belly as your pelvis rolls forward and your back arches off the floor. Then exhale and release your lower back slowly, coming back to neutral over a slow count of 12. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And pause here in neutral. This pause matters. Give yourself that rest before moving into the flatten. It's important to release all the way to neutral before you move again. This teaches your nervous system how to fully let go of muscle tension, rather than carrying a little bit of it forward into your next movement. From neutral, inhale down into your belly, then exhale, flatten your lower back into the floor, hollowing your belly, and release slowly back to neutral over a count of 12. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Rest here for a moment. Place your hands on your belly and take a few slow, easy breaths, feeling your belly rise and fall under your palms. Now we're going to explore the somatic internal and external hip release movements. But before we start, a quick note on how to do this well. It's really easy to accidentally turn this into a stretch, but that's not what we're going for. You shouldn't feel a stretch in the muscles as your knees lower down to the side. This is a slow, controlled release of your hip rotators, not a stretch. Move slowly enough as you lift that you can actually feel these muscles switch on. That's what lets you consciously let them go again as you lower. If you ever feel a stretching sensation, that's the sign you've gone a little too far. Just come back up a bit. These are subtle movements and they can be tricky to feel at first. If that's you, the answer is always to go slower and gentler and not to push further. With your feet already a comfortable hip distance away on the floor, we'll start with the internal hip release, but before we do, a quick word on your feet. Because your foot is going to want to roll along with your knee in this movement, we want to protect your ankle while it does. When we drop one knee out to the side, like we're about to do now, your foot will naturally roll over its outer edge, and that's completely normal. We're not trying to keep the sole of the foot flat on the floor, just let it roll slowly and with control at the same pace as your knee, not rolling or twisting ahead of it. So as we go, keep a little awareness on your foot. If you ever feel a twist or a pull at the ankle rather than a release higher up in the hip, that's your cue to not go quite as far. So let's begin. Slide your right foot to meet your left so your feet are touching and your right foot lines up with the center of your body. Slowly let your right knee begin to lower out to the side, not all the way, just about 1/3 of the way there. Stop and place your right palm on the front of your hip where it meets the top of your inner thigh. Now very slowly lift that knee up just a couple of inches, about 5 centimeters, and see if you can feel the inner thigh muscles doing the work. Then lower back down about 3 inches, so a little further than you lifted. Each time you're lifting less than you lower, so your knee gradually works its way down. Keep doing that with the same pattern, up 2 inches, down 3 inches, until your knee settles as low as feels comfortable for today. Remember, this isn't a stretch, there's no need to force anything. You're simply gently releasing the rotator muscles around your hip and the muscles of your inner thigh. Finish with the knee resting open to the side as far as is comfortable. Then slide your foot down, straighten the leg, and rest here a moment, noticing the openness through your right hip. We'll repeat this movement 2 more times. Bend the right leg, then slide the right foot over to meet your left. Slowly let your right knee begin to lower 1/3 out to the side and pause. Lift the knee back up 2 inches and pause. Lower it again as slowly as you can, 3 inches, and pause. Keep repeating this movement. Lift 2, pause, lower 3, pause, until your knee is as close to the floor as is comfortable. Then slide your leg out. And as you lower the leg down, do you feel that already you have more control? Is your knee coming a little bit closer towards the floor? Last one. Bend your right leg, then slide your right foot over to meet your left. Slowly let your right knee begin to lower about 1/3 of the way out to the side. Pause there, then repeat the same pattern as before, letting your knee travel a little further each time until it settles as low as feels comfortable for you. Then lift your right knee up and place your feet a comfortable hip distance apart. Next we'll move into the external hip rotator release, but before we start, a quick word on your feet again. When we cross the legs and drop them to one side as we're about to do, the foot on the floor will roll onto its inner edge, and that's fine. We want to protect your ankle as we move. So as we go, keep a little awareness of that foot, and if you ever feel a twist or a pull at the ankle rather than a release higher up in the hip, that's your cue to not go as far. So let's begin. Cross your left leg over your right all the way so there's no gap between your legs. Your left leg is going to act as a gentle added weight here. Let your arms rest out to your side, relaxed on the floor, or you may want to spread your arms out to the sides for stability. Slowly lower both legs together down a little to the left. You'll feel a lengthening along the right side of your waist and hip. Once you've lowered part way, slowly begin lifting your knees back up, not all the way, just a few inches, the same way we did in the internal release. You should feel your right waist, right glute and right hip doing the work to bring you back up. Then release those same muscles slowly and gently, letting your legs lower back down to the left, a little further this time if that's comfortable. And repeat this several times. Lift, pause and feel the contraction, then a slow, gentle release back down, going a little further each time for what's available to you today. Remember, this is a release, not a stretch. You might even feel the effect travel all the way up to the front of your right shoulder. One thing to watch, as your legs get lower, it may be tempting to lift your right shoulder off the floor to help them along. See if you can keep both shoulders resting on the floor and let your waist and hip do the work instead. even if that means your knees don't get down as low. It's not about how far you go, it's about staying connected to the muscles doing the releasing. When you've released as far as feels good for you now, let your pelvis roll back to centre and take a few gentle breaths. Then let's repeat this movement. With control, lower your legs towards the left, pause, lift the knees back up a little, not all the way, and pause again. Then continue, slowly lowering your knees towards the left, a little further each time, coming down as far as is comfortable. And then bring your knees back up. Then one more time. With control, lower your legs towards the left, bring them back up and pause, lower again and pause, repeating that all the way down to as far as feels good for today. And then when you're ready, bring your pelvis back to neutral, uncross your legs and take a few belly breaths, noticing whatever has changed within your body. Now for the opposite side. With your feet a comfortable hip distance away on the floor, slide your left foot in to meet your right so your feet are touching and your left foot lines up with the centre of your body. Slowly let your left knee begin to lower 1/3 of the way toward the floor. Stop and place your left palm on the front of your hip where it meets the top of your inner thigh. Now very slowly lift that knee back up 2 inches. Pause. Lower down 3 inches and pause. Then repeat that movement, lowering down nice and slow, a little further each time, until your knee settles as far down towards the floor as is comfortable for today. Then slide your foot down, straightening the leg, and rest here for a moment, noticing the openness through your left hip. We'll repeat that movement 2 more times. Bend your left leg, then slide your left foot over to meet your right. Slowly let your left knee begin to lower 1/3 out to the side and pause. Lift the knee up 2 inches and pause. Then drop down 3 and pause. All the way until your knee is as close to the floor as is comfortable. And then slide your leg out. Last time, bend your left leg, slide your left foot over to meet your right. Let your right knee begin to lower about 1/3 of the way out to the side. Pause, Then repeat the same pattern as before. Up 2, pause, down 3 inches and pause. Then when you've completed this move, lift your left knee back up and bring your feet hip distance apart. Now for the external hip rotator release. Cross your right leg over your left all the way so there's no gap between your legs. Your right leg is going to act as a gentle weight. Let your arms rest at your side, relaxed on the floor, or you may want to spread your arms out for stability. Slowly lower both legs down together a little to the right. You'll feel a lengthening along the left side of your waist and hip. Once you've lowered part way, slowly begin lifting the knees back up, not all the way, just a few inches, the same way we did with the internal release. You should feel your left waist, left glute and left hip doing the work to bring you back up. Then release those same muscles slowly and gently, letting your legs slowly come down to the right, a little further this time if that's comfortable. Then keep this movement, lift up, then drop down, coming a little further towards the floor each time. Then when you've reached the end range of your movement, bring your legs back up and let your pelvis roll back to center and take a few breaths. Let's repeat this movement. With control, lower your legs over toward the right, sensing which muscles are engaging. You may even feel the effect travel all the way up to the front of your left shoulder. Pause. Lift your knees up a little, not all the way, and pause again. Then continue slowly lowering your knees towards the left a little further each time, coming down as far as is comfortable. Then let your pelvis roll back to center. We'll do this one more time. With control, lower your legs towards the left, bring them back up a little and pause, lower and pause, repeating that all the way down to as far as feels good for today. Then bring your pelvis back to neutral, uncross your legs and take a few breaths. Now slowly come back to standing. Let your arms hang easily by your side and close your eyes if that's comfortable. See if you can recall how you felt standing here at the start. Now notice what's different and what's new. Check in with your feet on the floor. Is the weight distributed differently? Have your feet changed position? How do your knees feel? How do your hips and your lower back feel? Your upper back, chest, shoulders, neck. Are there any new sensations there? And notice how your head is resting now. And then when you're ready, gently flutter your eyelids open. that is the end of your somatic practice, my lovely friend.